if you want to slow the rate of heart disease development, the Mediterranean diet is probably the second. The worst, of course, is the typical Western American diet, filled with dairy and meat and cheese and bacon, pork, lots of oil, and it just absolutely ravages the guardian and the life jacket of our blood vessel, which happens to be that delicate innermost lining of the artery, the endothelium, which manufactures an absolutely magic molecule of gas, the nitric oxide, that protects us all. And nitric oxide has some absolutely marvelous functions. It keeps the cellular elements in our bloodstream flowing like Teflon rather than velcro. Number two, nitric oxide is the strongest blood vessel dilator in the body. When you climb stairs, the arteries to your heart, the arteries to your legs, they widen, they dilate. That's nitric oxide. Number three, nitric oxide will protect the wall of your artery from becoming stiff, thick, or inflamed, protects you from high blood pressure or hypertension. Number four, this is absolutely key, an adequate and safe amount of nitric oxide protects you from ever developing blockages or plaque. So literally everybody on the planet who has cardiovascular disease has their disease because they have so sufficiently trashed and injured their endothelial production of nitric oxide. They don't have enough nitric oxide to protect themselves from having plaque development and heart disease form. And what are the foods that every time they pass your lips, you injure the endothelium? Oil, dairy, meat, fish, chicken, and fowl. Lots of sugar, sugary drinks, stevia, agave, maple syrup, molasses, and honey. And when you have people eat without that, since this is not a malignancy, the endothelial cells recover and they start making more nitric oxide. And so literally what you're doing with these patients with heart disease when you counsel them, you are empowering them as the locus of control to halt and reverse their disease. None of the drugs do this, none of the stents, none of the bypasses. Those are all stopgap patch jobs. They just don't treat the causation of the illness. This is why somebody has their first stent, second stent, third stent, and it doesn't treat the disease. Yeah. And so this is why we had such exciting results. So as far as diets which have even more meat than the Mediterranean diet, which has a number of low-fat dairy and low-fat meat, but still they injure the endothelium, but not as bad as the Western diet. But if you go fully into the paleo diet, I mean, every time an omnivore, a paleo person eats meat, they're giving their intestinal microbiota, their intestinal bacteria are such that when they metabolize these two important molecules that are found in animal foods, carnitine and lecithin, they end up producing a vicious molecule called trimethylamine oxide, which injures the vessel. So really an invitation to eating a meat-based diet is an invitation toward hastening your vascular disease and a lot of other diseases.